what is unilateral hearing loss? So unilateral hearing loss is when one ear has typical hearing and there is some degree of hearing loss in the other ear. It might be mild to moderate, it might be severe or profound, and it may have been present at birth, or it may have been discovered later on in the child's life. Can unilateral hearing loss cause developmental delays? Just like bilateral hearing loss, unilateral hearing loss may result in speech or language delays. So it's important that children who there's a suspected hearing loss, that they be evaluated and diagnosed by a pediatric audiologist as soon as possible. Babies and young children with unilateral hearing loss can struggle with locating where a sound is coming from, understanding oral information fully, hearing speech in noisy places or from across a room. Should we get our child a hearing aid, cochlear implant, or therapy? So this is one of the questions that I am asked most frequently when I'm talking with a family of a child with unilateral hearing loss. Whether or not a hearing aid or cochlear implant will be helpful, whether or not introducing American Sign Language or cued speech or auditory verbal therapy would be helpful. Those are all things that parents and professionals can discuss and decide together. There isn't really one right answer for every child because every situation is different. The degree and type of hearing loss often dictates whether amplification would be helpful or is even available. And how the family wants the child to learn language is also something to be considered. So there isn't a one-size-fits-all answer. Should we enroll in early intervention or special education services? So in Virginia, infants and younger children diagnosed with unilateral hearing loss do qualify for early intervention or special education services most of the time. And I have found that families can always benefit from learning creative ways to ensure that their child is learning language appropriately in a home setting and outside of the home setting by partnering with professionals who are trained, specially trained in working with children with hearing loss, including unilateral hearing loss.